everyone. Today I'm going to walk you through step by step how to perform a complete pediatric assessment. Before we go into the patient's room, there are several things we need to do to prepare ourselves. We need to get nurse report, we need to take the time to look through the patient's chart, familiarize ourselves with why they're here, their MAR, look at the last assessment and set of vital signs, and just to have some general knowledge of the patient before we go into the room. We are also going to make sure that I have my name badge and all of my equipment. I have a stethoscope, a little paper and pencil or pen in case I need to write something down. Okay, we're ready. Good morning. Hi, I'm Emily. I'm going to be your nurse today. Do some hand hygiene. How are you feeling?
I'm feeling good.
You feeling okay today? Looks like mom's still sleeping over there. We'll just chat amongst ourselves and let her continue to sleep. Can you verify your name and date of birth for me, please?
Kate Oglesby in June 15, 2011.
Wonderful. Okay, I'm gonna do a quick assessment on you and take a set of vital signs, okay? Wonderful. Before I begin, I'm making observations. I'm looking at Kate's overall appearance, her hygiene, her nutrition status. She's not obese or underweight. She's appropriate. I'm noticing that her skin is appropriate for race. It is free of cyanosis. She's not jaundiced or mottled. I'm noticing that she is not showing any outward signs of distress. Her work of breathing is appropriate. Her chest rise and fall is symmetric. And she's answering my questions appropriate. Her language is developmentally appropriate. She's alert. She's following my gaze. And so now we will begin. When we are assessing pediatric patients, we go from least invasive to most invasive. So we always start with observation. That is our least invasive way to assess a patient, and we will move through to auscultation next and then palpation. We also do not begin at the head for a pediatric patient. I am going to start with the systems that I need to auscultate with, and we will work down Kate's body, and then we will go back up to her head and neck. Okay, so at this point, before I use my stethoscope, this is a perfect opportunity for me to count respirations while Kate is nice and relaxed, and I'm going to do that for a full minute. I'm not going to rely on the monitor. I'm going to rely on my counting. Okay, perfect. I got 16 breaths per minute, and I'm going to record that in my piece of paper and keep that for the rest of my assessments. Wonderful. Okay, Kate, what grade are you in? Ninth grade. What do you like to do at school? Play any sports?
I play soccer.
You play soccer? Cool. You play for school?
Yes.
Nice, right? I'm going to listen to your breath sounds if that's okay. I'm going to move your hair out of the way. Just to respect Kate's privacy for the video, I'm going to auscultate above her t-shirt, but know that you need to auscultate with real patients against their skin. So I'm going to start here at the top. Listen to Kate's breath sounds. You can just read more nice and normal for me. Wonderful. I'm going to ladder step it down bilaterally, comparing both sides. Wonderful. Okay, Kate, would you mind sitting up for me, honey? I'm going to listen to her posterior breath sounds in the same fashion. Breath sounds are clear. No wheezing or any other advantageous sounds. I'm going to take a quick peek at Kate's back, looking for just Any deviations to her spine, I'm also looking at her skin, making sure that it's warm, dry, intact, free of any signs of bruising, lesions, child abuse. Okay, I'm gonna lay you back down. Continue with my stethoscope here and listen to your heart. It's my cardiac landmarks. Listening for normal rate and rhythm, S1, S2, absent of murmurs, the apical pulse. I'm going to pause here and I'm going to listen for a full minute and record this as her heart rate. I'm not going to rely on the monitor. I'm going to rely on my own skills. Okay, wonderful heart rate. Just jot that down real quick. 60, which is appropriate for an athletic teenager. Wonderful. I'm going to do the rest of your cardiac assessment when I'm assessing your extremities. I'm going to continue with the auscultation part of it. Before I do her abdomen, I'm just going to observe. She's got a nice flat belly here. I'm going to auscultate her bowel sounds. Because Kate is a pediatric patient, we are just listening long enough to hear bowel sounds. We don't need to listen for any specific amount of time, just until I can hear her belly gurgling in all 4 quadrants. Wonderful. Okay, do some light palpation. Okay, any tenderness here, honey? Okay, not feeling any masses or abnormalities. Wonderful. Okay, good. Okay, when's the last time you pooped?
A few days ago. Actually, yesterday.
Yesterday, okay. And is that normal for you? Do you normally go every day, every other day?
Every other day.
Every other day, okay, great. Tell me about your diet. Do you eat breakfast before you go to school?
Yes.
Yes, what do you like to eat?
Like eggs with fruit.
Oh, great, wonderful, okay. Do you normally eat a good amount of fruit? How about vegetables?
Yes, like every dinner.
At dinner, great. What do you like to eat for lunch?
A sandwich with like some like chips.
Okay, good. You know, you're a soccer player, so you got to make sure that you're getting fuel throughout the day, right? We're eating good quality protein, fruits, vegetables, whole grains. You feel like you do a good job of that?
Yes.
Okay. How about what do you like to drink?
Water.
Okay. Drink a lot of water?
Yeah.
Okay, wonderful. Good. Okay. Since Kate is a adolescent patient, it wouldn't be appropriate for me to assess her GU system unless it was specific to why she was here in the hospital, which it is not. So instead, I'm just going to ask you a few questions. Are you going pee okay? When's the last time you went pee?
Like today.
Today, this morning, before I got in here? Okay, good. Any burning, irritation, itching? Anything like that? Noticing any foul odors or anything? Okay, when was the last time you had your period?
A few weeks ago.
A few weeks ago. Any chance you could be pregnant? Okay, excellent, great. So we're done with that portion. Now I'm going to move on to extremities. Throughout the entire assessment, I am looking at Kate's skin. So on her upper extremities, I'm noticing her skin again is warm, dry, intact. Good color, appropriate for race, free of lesions, bruising, anything that I need to be concerned about. Wonderful. Okay, now check bilaterally, check your pulses. Nice strong pulses. Good. Okay, check skin turgor, cap refill. I can actually see a little bit under those nails. Now I'm going to check your upper extremity strength. Go ahead and grip my hands real good for me. Okay, good, very strong. Now I'm going to put my hands here. You push your palms up against my hands. Okay, and flip your hands over and do the same. All right, now push down on me. Very nice, good. Kate is also moving freely, both extremities appropriately. So you can move down. Is it okay if I take this blanket down? Okay, wonderful. I'm going to take a look at your legs. Very common for our adolescent patients to remain in their home PJs when they're in the hospital, and that is perfectly fine. It gives them a little bit of autonomy, control over the situation that feels pretty out of control to them being in the hospital. So as long as I can get to what I need to assess appropriately, then I'm perfectly okay with my patients being in PJs. Now, if I needed to assess an area on Kate, if she had a wound on her thigh or had a broken femur, obviously she'd need to be in a gown. But for today, she is completely okay to stay in these PJ pants. I'm just gonna take a look at your legs, okay? Skin again, warm, dry, intact, free of bruising and lesions. Wonderful. Okay, good. It's okay if I take off your socks? Okay, take off her socks. Ooh, I like your blue toenails. Very nice. I'm gonna go ahead and check her pedal pulses here. Great. Refill again, good. In the essence of time, you'll notice that I'm moving pretty quickly and I'm only checking one peripheral pulse point per extremity, which is completely okay for pediatric patients. We need to move quickly through this. You don't have as much time with the pediatric patient to sit here and assess like you would an adult. So I am moving quickly, getting the pulse point that's furthest from her heart. I know she has great circulation all the way down her extremity because I'm checking furthest away, and she's got good cap refill. I feel good about her circulation. Okay, go ahead and push down on my hands. Wonderful. Okay, you can push up. All right, let me see you bend your knees. You bend them all the way up. Oh, very nice. Great. I'm not gonna get Kate up out of the bed at this point to walk, but I'm gonna try to observe that at some point during my shifts. So, okay, very nice. I'm gonna cover you back up. Good, I'm gonna go back up to your head if that's okay. Take a look through your hair. No signs of anything that I need to be concerned about in her hair. Hair is nice and clean. Okay, head is normal cephalic. Okay, I'm looking at her neck, trachea is midline. I'm noticing just a very easy lymph node assessment here. No really enlarged lymph nodes, and that's about as much as I'm gonna do for lymph nodes on Kate. I'm looking at her ears, I'm looking at symmetry, wonderful. Pinna is nice and symmetrical, or canals are symmetrical. I'm looking for any drainage, odor, foreign bodies, things like that. Looking at her eyes. She's been following my gaze the entire time. She has very good visual acuity. She's doing a good job with that. So I'm going to look at her pupils. Now, I don't have a pen light handy. I don't need to use my pen light for a routine PEDS assessment. So what I do instead is I'm going to ask Kate to just put her head back, and I'm going to put my hand over your eye, and you can just sit and relax and keep your eye open, okay? Put my hand over. Okay, good. I can see her pupils respond. Wonderful. Okay. I'm looking at her nose, pink mucosa, symmetrical nares. Look in her mouth. Can you open your mouth for me? Stick your tongue out. Great. No lesions, no signs of thrush, pink mucosa. Wonderful. Put your tongue back in. Can I see your teeth? Oh, very nice teeth. Kate's clearly had some wonderful braces and brushes her teeth. Very good. Wonderful. Great. Okay. Throughout this assessment, I'm also going to make note of the dynamic with mom at the bedside. Take note of Kate's psychosocial assessment, how she is bonded to the mother, answers my questions appropriately. Wonderful. Okay, are you nice and comfortable? I think I'm all set for right now. Actually, you know what I need to do? I need to finish up my vital signs. I'm going to move around this side of the bed because so far we've only assessed Kate's respirations and heart rate. So now we're going to do blood pressure. Our younger patients often find blood pressure more invasive, so I like to wait to the end of my assessment to finish up my vital signs. So I'm going to hold Kate's arm nice and still, plug it in, hit the monitor, okay, big squeeze. All right, wonderful, that's good. Blood pressure. Okay, check your pulse ox. Put this on your fingernail right here, plug you in. Hit the monitor. I'm gonna hold her hand nice and still here. Whoop, let's put that on. I'm gonna hold her arm nice and still so I get a good reading. Okay, great, 100%, take that off. All right, now temperature. It would be age appropriate for Kate to use an oral thermometer because she can hold the thermometer under her tongue, tongue down, mouth closed while it's processing. So we'll do that. Okay, wonderful. Got that all finished. Kate, are you having any pain today? No? You comfortable?
Yes.
Anything I can get for you before we leave?
I'm okay, thank you.
Okay, wonderful. And I'm gonna put this bed rail up. Okay, and I'll be back in about an hour to check on you, okay?
Okay,
All right, wonderful.
thank you.
Welcome. So now I'm gonna go back out and I'm gonna document my findings and make sure I've got Kate's medications for the medications that are ready to be given in an hour. And there we go.